If you're looking for a primary care physician and you'd like to have an MD, but you're concerned because you like to do things maybe in a more natural way, who knows, maybe taking supplements instead of medication, or maybe trying nutrition instead of injections, or maybe natural therapies over surgeries, then if that's you, then you probably think that there's not an MD out there that would support you in your desire to be healthy naturally. If that's you, then I have a treat for you today because Dr. Patty Petralba is an integrative medicine physician, and she does just that. She can combine and does combine the natural methods with the traditional methods to try to give you the best of both worlds. So I want to take a moment and welcome you, Dr. Patty. How are you doing today?
Hi, Dr. Tompkins. Thank you for that introduction. I'm well, and thanks for having me.
I really appreciate you being on today. And I know that I have people who have questions. And so we're going to get to questions in a moment. And actually, for any of you that are on, and many of you are going to see this on replay, but if you're on right now, then feel free to ask any questions. You can pop those questions in the comment section here. If you have any comments, you can stick them right there too. That is just fine. But Dr. Patty is available for questions, and just want to make sure that you can pop them down in the comments. So you mentioned in your bio, actually, tell me a little bit more about yourself.
Yeah, so I am an MD. I'm a medical doctor. My
Mm-hmm.
background is hospital medicine and primary care until I shifted to more integrative medicine, which is essentially a combination of what works for you. And that is, it can be Eastern, it can be Western, it can be naturopathic, homeopathic, and functional medicine. So I combine all those things to make sure we are thorough and so that we get to the root cause of your symptoms. So it's not just
Yeah.
symptom resolution, it's addressing the root cause.
Oh,
So that's
and
how it is. Yeah.
yeah, and that's fantastic because I think a lot of times, and I don't know about you, but sometimes I think traditional medicine can get a bad reputation of only focusing on that one symptom. And sometimes if we're only focusing on that one symptom, there is that possibility we can miss the person as a whole. So it really is interesting that you look at things that way, and I
Yeah.
really appreciate that. Now,
Yeah.
you mentioned in your bio that you look back at your indigenous roots in the Philippines in your work. How do you do that?
So I grew up there. So I hold them, I hold the memory of growing up there. We honor a lot the spiritual world, and I don't mean that in just in religious terms, but how those who walk before us does it. And so
Mm.
it can be anything from ritual medicine, ceremonious medicine, narrative as medicine, weaving stories, no, from the past and aligning it with your current state. And of course, I have my elders that I still keep in touch with. Sure, we think about how we can provide a good future to the next generation, keeping in mind the elders in our community. So that's how I still keep informed with my indigenous roots. Yeah.
Oh, wow. That's
Mm-hmm.
wonderful. Now, you had mentioned as I was doing some research on just how you have your approach to medicine, you had mentioned conventional medicine's culture of segregation and how you're different. What do you mean? What do you mean by that?
So generally, let's say you, a patient, or whoever's listening, would go to a primary care, and then in case the primary care cannot handle the case anymore, and the approach typically is conventional, which is pharmaceutical or refer to a specialist, and then the patient then will be referred to all these other specialists and sees you as an organ, separate organs. And so that's how I come in. Aside from conventional medicine is fantastic, it's fantastic for life-saving medicine,
Yeah.
for security and diagnostic. That's where we're great at there, no? The Western diagnostic convention. But it can get overwhelming, and then you get lost. Oh, wait, exactly how do I approach this? And do I just want pharmaceutical? Do I just want surgical? And that's where I come in, where I piece everything together and help the patient step back and look at their health with my guidance, because I'm not the one doing the healing. No, so
Hmm.
I encourage them to listen in a way that's holistic to their own body, mind, and spirit. Because I view myself as a mirror
Yeah.
or a listener. And then I send back whatever the mind, body, spirit is telling me. So to summarize, no, integrative is not just the approach of natural and homeopathic or functional medicine. It's also piecing all together what the
Hmm.
specialist had said, what your primary care physician had said. So it feels more full and not overwhelming,
Yeah.
with the approach of
Yeah.
leaning more towards natural.
Oh, that's great. It's
Mm.
something that we see in our office a lot, and it almost doesn't matter the type of the provider, not medical or natural or anything, but they'll go in somewhere and they'll say, I had this issue and they only looked at this one thing and they told me that this was the only answer and there wasn't anything else. And my response to that typically is it's not necessarily anything wrong that was done by that doctor, but a lot of times the doctor, they have their very specific focus. They have their thing that they can provide, whether it's maybe a medication for your pain or something like that. That's what they've got, and so that's what they're
Mhm.
going to offer. And and it's just really refreshing to see that there are places you can go, and what you've got, what you're offering, is so much more than just one specific thing for one specific type of condition, because people's bodies are much more complex. They're
Yeah.
treating issues and concerns that they have is so much more than typically that one body part potentially that they're feeling the pain. And so being able to address those other areas really can be powerful. Let's chat real quickly about women's health. I know that you tend to really focus on helping women and their individual healthcare needs. Talk to me about.
Just like Nelson Mandela said, if you want to change the world, help the women.
Mm,
So that's one of the many reasons why. But women's health is very unique because we go through phases and cycles.
mm,
And that's like the feminine paradigm. Like it's a flow. We have our flow. We have our
mm-hmm.
seasons from menstrual age to fertility to menopause. And so we shift a lot. And that's why I wanted to focus on women's health, because it's quite complex. And I always want to encourage women to honor their cycles, because how often do I
Yeah.
hear women say things like, "Ah, it's that time of month again. My hot flashes." No, so instead of working with their biology, working with their cycles, we tend to through in this model that's a bit more, unfortunately, patriarchal and linear and masculine. Not
Mm.
that there's anything wrong with the masculine way, but it's not just in line with our biology. So there's a lot of mindset and hormonal, functional medicine, acupuncture that I incorporate with women's health.
Ah, okay. Okay. So just as a practical question here. If you
Yes.
saw someone, let's say they were dealing with hot flashes and they felt like that
Mhm.
was just out of control and they came to you, what is the experience like in your clinic in dealing with something like that?
I usually start with pattern recognition, knowing the hindsight, what got you here. Because hot
Mm-hmm.
flashes, menopause can be pleasurable. We don't need to go through these hot flashes. So we go through pattern recognition. What got you here in the first place that made your hormones off? And then we go through functional approach, meaning not just taking the lab values, but how your body actually metabolizes the hormones. And then the treatment can be anywhere from nutrition, movement, acupuncture, herbs, sometimes bioidentical hormones. But yeah, I lean more towards short term pharmaceutical to give us compassion. No? I think pharmaceuticals is a way of empathy and compassion while we figure out
Yeah.
how to on the lifestyle. And then, so that's usually what we go through. So we learn first why we got where we are now.
That's great. That's really great. And I see we've got a couple of people on right now live. And so I just want to say, while you're on, if you have any questions, this is a great time to be able to ask any questions. You can put those down in the comment section. Just pop a question in there, and Dr. Patty is happy to answer it. That's great. Now, you had indicated, and I think in some ways you started to answer this. You had indicated that you have this desire to make an impact on the community level and even not just the individual level. How do you do this? Or how do you plan?
One, so aside from focusing on the women, I also have a special heart for pregnant women, because if we take care of the pregnant women in utero, no, the future generation already feels taken care of. And every one of us, if you ask
Yeah.
anyone, especially women, how was your birth? We all have our birth stories, right? We all have our
Yeah.
birth story. And so I start with birth. I'm also a hypnobirth coach. So this is how I round up women together in our birthing classes. And then I teach them on how to use hypnosis to relax themselves. And that also provides a community for all these women and fathers as they enter their family life.
What was
I would
that? Yeah. Yeah, that's wonderful. And it's, I think, for each of us, and this is part of why you're here in the first place. I always want to make sure that we're featuring people that are out there making an impact on the community, who are doing something not just for themselves, but a desire to serve others, and then a desire to serve maybe not even just the people that they see right in front of them, but to have a larger impact on our community. One thing that we call it, at least in here, we have this desire to make a difference in our corner of the world. And so we don't have to ourselves make a big difference in the world, but gosh, just in our little corner, we can do little things to make bigger and bigger impacts. Your desire to help pregnant women not only affects mom, but it affects the kids. And when you start having an effect on mom and baby, you impact a family. And as you impact that family, can then impact a community, and it just builds and builds from there. It's really awesome to hear. So we have a question. Here is our first question. Let's see if I can put it up on the screen. It says, "Do all women need to be on hormone medicine during menopause? And how do I know if I should be on something?" So what do you think?
Good question. The short answer is no, not all women should be on hormones. You can support yourself with your own hormones through X, Y, and Z. So one is lifestyle, nutrition. And how do I know if I should be on something? It will not be subtle. When you're on menopause, you'll know. So it can be things like, so I'll go through mind, body, spirit. No? So from the mind, it can be feeling on the edge, uninspired, sleepless. Body, so the typical is hot flashes and weight gain. And then spirit, it can be spirit is in integrative medicine, or how I use it, is connection. If you feel a lack of connection to your meaning and purpose, so those can all be menopausal symptoms that I suggest you engage your primary care or your OB or me, an integrative women's health physician, to support you so that menopause can be peaceful, because it can be.
That's wonderful. Thank you so much for answering that. And thank you for putting that question there. We are here to answer questions. And so if you have questions, definitely feel free to put those in the comments. We are happy to answer those. Question that I have, and something that I've noticed, that your model of healthcare and how you do things, to even how people pay for your services, it's different than the traditional healthcare model. Is that right? And how is it different?
One is I'm not insurance based for many reasons. One is I am accessible to patients, meaning they text me, they call me, they email me without going through the hoops and loops of all the front desk, whatever desk, and I usually respond immediately because when I'm out of that insurance model, I don't need to be in assembly line medicine, meaning next, next, next. I have time for you. So the other difference with my model is I spend generous time with you. The 15-minute, 20
That's
minute,
rare.
yeah, that's rare. 20-minute visit with your physician is just my meet and greet. So I spend generous time, and the same way it saves time for my patients because they rarely wait in the waiting room. I know a lot of people also complain about how much they wait in the waiting room. So my patients
Yeah.
rarely wait. And cost. So the cost is affordable because I have negotiated personally with the diagnostics, the x-rays. For example, like MRI, if you're my patient, the pay is around 300, 350. So that's
Oh,
like your copay with insurance.
oh, 300. Yeah. If 300 to 350, when that's about a $1,500 test. That's,
Exactly. Yeah. And I know how much healthcare can cost. And I want it to be accessible and approachable to all, that I negotiated these things that can cost a lot of stress. So that's how I make it worth it that I'm outside the insurance model.
yeah. More questions come up. If you have a question as you're watching right now, just go ahead and stick that down in the comments. And Patty, Dr. Patty, is happy to answer those questions. All right. Now, I thought I saw something regarding healing the healers. Do you provide some kind of specific services for, I don't know, other healthcare providers, or what do you do?
Yes. So going through, and I'm sure it's similar to your training, Dr. Tompkins, where we're bombarded with schooling. We get used to in this high level of stress, and we care for a lot of people. And so who then takes care of the healers? So I have a special space for my brothers and sisters in the healing arts where I give them space to really unload and the physician burnout, no, to address that because unfortunately there's a very high statistics of suicide
Mm,
in our medical community,
yeah.
and there's no much room given to talk about that or even to have that safe space. So yeah, I see my brothers and sisters in medicine to heal the healer, the wounded
Yeah.
warriors.
Yeah.
Yeah.
That's fantastic. Thank you so much for what you do. I see that you have a wait list. So how would someone contact you if they want to see you? What's the step that they would?
I highly encourage to enroll in the wait list. There's a link on the website to enroll.
Mhm.
So that's our electronic medical records. And then you would automatically be on the wait list or email me info@thrivelifecenter.com. Yeah, like I said, I'm super accessible. Whoever's listening can email me to inquire about the wait list. And I do require to have a meet and greet first before establishing to
Yeah,
make sure we're a good match. So there's a meet and greet. So yeah, make sure
that's
that
great.
we work together well. Yeah.
That is wonderful. All right. So what I'm going to do is make sure that I put your email in the comments. So it'll be something that you should just be able to grab out of there. So once this is over, that will be there. And if you're watching the replay, it's probably already there in the comments. info@thrivelifecenter.com. Dr. Patty, I want to thank you so much for hanging out with me this afternoon. Thank you so much for what you're doing in our community. And for those of you watching, I mentioned it before, during this time, this pandemic where things are changing all around you, think about who are the people that are stepping in to lead the way in providing leadership, health, wellness in our community. The people who are stepping in and taking part in this outreach that we're doing here are those people. If you're in Tucson, if you're in Southern Arizona, and you want that leader in natural health care that also provides traditional medical care, Dr. Patty is doing it for you, and I encourage you to seek her out if you're looking for an MD who can look at all those things more naturally at Thrive Life Center. Dr. Patty, thank you for joining us. Do you have anything else you want to leave our guests that are watching today?
I wish you all the gift of listening, no, because when we truly listen and empty, that's when healing can start. And thank you, Dr. Tompkins, for having me. It's a pleasure.
Thank you so much. All right, guys, if you have any questions, you know how to get a hold of Dr. Patty. If you have any questions, you can also put them down in the comments, and we will still work on answering those even after this video is over. Really appreciate you joining us, and stay tuned for our next interview. But if you ever need a natural healthcare provider who can bridge medicine and bridge all the natural aspect and provide it specifically, especially in the area of women's health and family health, Dr. Patty will do it for you. All right. Thank you so much for joining us. Have a fantastic day. Dr. Patty, thank you for being here. And guys, we'll see you later.